the water immersion technique for colonoscopy insertion. As for standard colonoscopy, the water immersion technique starts with the patient in the left lateral position, figure 3, so that the progressive irrigation of water eases down the sigmoid by gravity on the left abdominal quadrant. Instead of syringes, the use of water flushing pumps allow to better adjust the quantity of water needed according to the morphology of the sigmoid and does not delay the maneuvers of scope progression. While the air insufflated in the rectosigmoid tends to escape towards the right colon, enhancing the tilts of the rectosigmoid and sigmoidodescending angles, the effect of water is to make the sigmoid heavier so as to make it lay down in the left abdominal cavity, figure 4a. If at the same time residual air is suctioned away and further water is irrigated, figure 4b, the sigmoid loops are progressively flattened, facilitating the progression of the scope toward the descending colon, figure 4c. If the sigmoid loop is particularly curvy, with coil spring appearance, figure 5, the installation of water instead of air prevents exacerbation of the curvature during progression of the scope. In this way it is often possible to prevent the formation of an alpha loop, with easier straightening of the sigmoid and negotiation of the progression toward the descending colon, figure 6a to d. In case of a very tortuous sigmoid, the irrigation of water instead of air insufflation prevents the widening of the sigmoid loop and the risk of an alpha loop formation. Instead, it facilitates the torque maneuver to directly straighten the sigmoid, corkscrew twist technique, and progression toward the descending colon. Once the colonoscope reaches the descending colon, figure 6d, the patient can be rotated in supine position, figure 7, in order to facilitate passing of the flexure because it corresponds to a clockwise twist of the colonoscope. If needed, excess water can be removed before engaging the splenic flexure.